Right now we're on with Dr. David Newell. He's at Swedish Medical Center. We are connecting via HD video back to the Swedish Medical Center. We've got Jamil Mack here, who is going to actually talk a little bit about how this technology is going to be used to allow for remote advice.
So we utilize this technology currently for our telestroke program, which is the largest in the region. We provide stroke care for rural health facilities throughout the state. And it is real-time video that we are able to consult with ERs at rural facilities and do real evaluations of the patients with cooperation of the emergency department. So we're looking also at other applications for neurosurgical consultation and other groups.
This is, I think, the future of medicine is going to be about this. In the past, it's always been that a patient had to travel a long distance to see a physician, especially a specialist or an expert outside of the community. It meant a lot of hardship going back and forth. It really, now the same kind of information can be exchanged simply by using a system like this. The limitations before were the resolution, the sound, and the delay in the transmission of the image. That's been overcome with this new technology, and as you'll see, we're able to exchange information about a patient in real time in very high resolution. And I think it's going to eliminate the need to move patients' X-ray films and other information physically from place to place. And we'll be able to use this technology for patients anywhere in the world, 24 hours a day, 7 days a week. What I'd like to do today is just show typically how a teleconsultation might take place. And we're going to use Jamil as an example. I'm talking to Dr. David Newell. Dr. Newell is a world-renowned expert in neurosurgery in the field of cerebrovascular disease, but also in spinal disease. And what we have is a telecommunication setup that consists of a high-resolution screen. On that screen, I can see the images that we have here of Jamil's back, and in the corner is Dr. Newell, and I'll be able to have a face-to-face conversation with him. Dave, can you hear me there?
Yeah, I can hear you quite well.
And
I have on my screen here, which I can actually pan over to, the X-ray films. I can. This is the image of the blown up image of the spine, which I can look at simultaneously to any imaging that you're doing up there. If you have the same images up, I'm looking at the identical image on this system right here.
so
I can also, if Jamil happened to be a patient, I can see him quite clearly, and I have control of the. I can zoom in and move the camera and so forth around here, and then I can also switch to the far camera and zoom in over there. So, for example, right now, I can go and zoom in on the patient. If there's something I'm not seeing as clearly as I want to, like how he moves his leg or his hand or something like that, we can go into quite a bit of detail there with high definition capabilities. And also, if you notice, there's really not much of a delay in the speech, between the speech and the movement that you're seeing on the screen. And this is just over a T1 line, which is fairly standard in most businesses right now. But we've set up the same thing actually at a center in the Middle East and Saudi Arabia, and we can talk to the people with the same resolution and the same lack of any kind of delay in transmission signal. So it allows us to conduct the same type of evaluation with a patient anywhere in the world, really. We have Dr. Askuian here, who's another very well-known spine surgeon in the region. He usually comes in and asks advice on certain easy cases, complex cases that he does, and so forth.
again, another example of The power of this is that large groups, more than one physician can be brought in, and it just happens that Dr. Iskuian is in Dr. Newell's office, but Dr. Iskuian could just as well be in New York and in on the same teleconference at the same time, exchanging ideas, and it's really going to revolutionize medicine. So in this typical kind of a setting, a healthcare provider here in this office would have interviewed Jamil, taken the information, examined him, and then made this simple connection with a button and presented that information to Dr. Newell, who would also have the x-rays. So I'm going to just do that as an example. So Dave, this is a 29-year-old man with a several-month history of back and right leg pain. He was coming down some stairs. He slipped on the cement and struck his back. Since that time, he's had pain that radiates into the right buttock, down the posterior aspect of his leg, into his foot. The lateral aspect of his foot is numb. When I examine him, he has a little bit of weakness in his quadriceps muscle and some numbness over the lateral and lateral part of his foot and the bottom of his foot. When I raise his leg, the pain radiates out of his back into his right leg in the same distribution. So he has a positive straight leg raising sign on the right. The remainder of the examination is normal. His health is otherwise excellent.
Okay, well, I'm looking at his MRI scan on my screen here, and it looks like there's a very small disc bulge. My personal recommendation, if it was a short interval of time, I would give him some non-steroidal anti-inflammatory medication, some muscle relaxants. Most of the time, these disc herniations will actually clear up with time, within 6 weeks. And the other advantage of this situation, if we had a difference of opinion, I could, for example, Dr. Iskuian, I think he'd often recommend a fusion from, the first 4 or 5 lumbar segments down to the sacrum. But we could go through a panel discussion of 3 or 4 physicians and come up with the best solution for any.
This patient who otherwise may have had to make an appointment in Seattle, wait a few weeks with some uncertainty about the diagnosis, drive to Seattle, park a car, go to an office, sit in an office, have the examination there. All of that's been circumvented, and this information, which is great news, that he doesn't need surgery and that this can be treated with conservative care, has been accomplished without any of that. We would expect that Jamil would do well with that, would get his care here, would get his physical therapy here, and would get back to work and be a happy and productive member of society.
Technology moving into the operating rooms so that difficult cases can be reviewed or consulted with on the spot if there's an issue.
The question was whether this can go into the OR, and in fact it does. When we built a series of new operating rooms at Swedish, and they're all wired with this technology, we're just upgrading them to HD now, and that's exactly what we do. We frequently do intraoperative consultations and demonstrations and showcases how we're doing it, but we'll have the ability also to look into ORs around the world and give advice to surgeons in real time.
Dave, I could address this question to you. Hi, thank you for helping us today with the demonstration, by the way. And Iskuian's just around the corner there someplace. Would it be possible to telemedicine all the way from my office here on Rucker Avenue to the new Providence Regional Medical Center tower on 14th and Colby? What do you think, Dave? You think that's possible?
That's a long way away.
He said absolutely.
I can see you very clearly and hear you in real time. There's no delay on the voice. I don't know if it's the same for you when you're watching on this side.
Looks great.
Well, listen, Dave, thank you, and thanks to Rod and Mark and Jamil and Sandy and Sean and Diane from my office for making this demonstration possible. Thank you. Mark, would you like to conclude?
Dave has this in his office, but I expect we'll all have this in our house in a couple years.